So, good evening, friends. Just let me know if you can see me live so that I can start the session. Can you all see me live? Just let me know. Once I have a confirmation, I can start the live session. Okay. So, welcome everybody. In today's session, we will look at some of the MCQs which are on epigenetics. Again, epigenetics is a very latest topic. So, hi Rockstar, hi Moksh. So, as a ritual, just as a drill, let me just tell you about our Unacademy NEET PG Telegram group. So, this Telegram group you can simply find by searching for Unacademy NEET PG, all small, all without space. In case you are not able to find, many students say that they are not able to find this group, then this is my Telegram number. You can simply reach out to me and I will add you to this group and a couple of other important groups also, 9494088000. Even if you have found this group, you can simply write a hi to me and we can get connected over Telegram. Okay. Hi Rajeshwari. And you know the sponsors for this session are Unacademy. Unacademy is India's largest teaching platform, and then we have got Ladder. Ladder is one of the best preparation platforms for NEET PG. So both of them now are together, and you can get the benefit of both Unacademy as well as Ladder in our iconic subscription. So you know that Unacademy is mostly about live classes, live quizzes, tests. So there's a live discussion on Unacademy, and Ladder has the best Q bank and video lectures and revision courses. So both of this, especially if you're an intern, post-intern, you can get both these benefits in iconic subscription at Unacademy. So when you are going to subscribe for Unacademy on Unacademy platform, make sure you can just select the iconic and you can choose whatever duration you want. And if you use this discount code Dr. Abhishek 10, you will get a discount on the iconic subscription. Similar discount you can get on the Plus. So Plus is the regular live classes which we have at Unacademy. So again, you can choose a 1, 3 month, 6 month, 12 month program on the Plus program. And again, you can use the same discount code Dr. Abhishek 10. Okay. So all without space, all small. And again, you can get a discount on this. Plus is more about, if you want to just try out Unacademy for 1 or 3 months, you can think of. If you are a first, second, third year, then you should go for a longer period, like say 3 years or 2 years, depending upon which year you are. Okay. If you have any doubt, you can reach me on Telegram. I have given you my Telegram number. If you are confused, is Plus useful? What is the duration you should go for, or you should go for Plus or iconic? You can always reach me. There are so many students who reach out to me, and I, according to whatever college year and whatever their preparation status, I am able to guide them. So now, having said that, you know how to subscribe. You must have downloaded the Unacademy app. You should download, because even if you're not going for the Plus subscription, what will happen is there are a lot of free classes we take there. Like we take a lot of free classes on YouTube. We take a lot of free classes on Unacademy platform also. So you should download it. Once you have downloaded it, there is an option to upgrade. And if you like to upgrade, you can use this discount code Dr. Abhishek 10. So having said that, thank you. Let's start our today's session on epigenetic modification. So hi Moksh, Rajeshwari, Pranav. Let's start with our first question for today. And you can all answer this. All are true about epigenetic modifications except. All are true about epigenetic modifications. So Moksh says A, they are non-heritable is wrong. Anyone else? How about Rajeshwari? How about Pranav? So Kishore also is saying yes. So both, of you are correct. The correct answer is this is wrong about epigenetic modifications. So epigenetic modifications are heritable. Okay. So there are some classical important points about epigenetic modification. First of all, remember, these modifications do not change the nitrogenous base. Okay, so the nitrogenous base remains the same, but apart from nitrogenous base, either the histone proteins or the non-histone proteins, or even the bases, they remain the same, but they can be methylated. Okay, so all these changes in the histone protein, non-histone protein, or methylation of the bases, all these are epigenetic modification. Okay, now some important point is they are heritable, which means they can be passed from one generation to another. Again, a second very important point is they are reversible. Okay, so they are not irreversible. So spontaneously, if something has been methylated, some gene has been methylated, they can be not demethylated also. So they are reversible also. This is again a very important point which you should remember. So these are reversible, heritable changes in the non-nitrogen and anything apart from the non-nitrogenous part, like say histone protein, non-histone protein. So yes, it will include acetylation of histone protein, methylation. So everything else is correct. The correct answer here is non-heritable. Okay. Very good, Moksh. Let's answer this question. The common site for DNA methylation is all except. The common site for DNA methylation is all except. So your options are operator site, CPG islands, cytosine residues, and promoter site. Moksh again is very quick to answer. So operator site, Moksh is saying Rajeshwari. Both for what? Anyone else? So is everybody feeling that the operator site is the correct answer? So you have to remember that all these three options, the CPG island, cytosine residues, and promoter, all these are basically the same. Okay. So what happened, right? We know that a transcription gene will have a promoter site. Okay. These promoter site classically have CPG island. What is a CPG island? That there is a cytosine residue, there is a phosphodiester bond, and there is a guanosine residue. And on both of these sides, there is neither a cytosine, neither a guanosine. So this is called a CPG island, which means here there cannot be a cytosine, here there cannot be a guanosine, here there cannot be a cytosine, here there cannot be a guanosine. So this is a CPG island. Okay. Remember, the CPG island is present on the same, on the same strand of DNA. So this is CPG island. So classically, these CPG islands are a part of promoter site. Okay. Classically, these CPG islands are a part of promoter site, and in this CPG island, these cytosine residues are methylated. Okay, and once they are methylated, one of the important effect is that they will lead to non-expression or reduced expression of the DNA. Okay, so all these are basically the same thing. So DNA site common methylation is not the operator site but the promoter site, especially the CPG island, and on the CPG island the cytosine residues. So Moksh, are you clear what is CPG island? Moksh, are you clear about the CPG island? So basically, suppose this is the two strands of DNA, cytosine, phosphodiester bond. So this is phosphodiester bond and G is guanosine. On either side, you cannot have a cytosine or a guanosine residue. Is it clear, all of you? Very good. So all these three are same basically. Okay, this is operator site is not a common site for DNA methylation. Okay, let's look at this. Which of the following favor permissive chromatin? Okay, so there are two. Permissive chromatin is another way of saying that there is a increased expression of the gene. Okay, so we know that there can be a permissive or a repressive chromatin. Okay, repressive. In repressive, there is a decreased expression. So here we are asking which of the following favors permissive chromatin. So Moksh is saying DNA methylation. Okay. Anyone else? Anyone else? Kishore, Rajeshwari, anyone else wants to answer this question? Which of the following favors permissive chromatin? So Moksh now has said that it is A. Kishore also is A. Okay, so the correct answer here is DNA acetylation. Now this is a very favorite one-liners which have been asked in few years, where what is the epigenetic modification and what effect it has on the gene expression. Okay, sometimes, like say, what happens in acetylation? What is an acetyl group? This is an acetyl group. Okay, this is an acetyl group. So this acetyl group is a negatively charged group. Okay, and we know that DNA is also negatively charged. Okay, so negative will repel, and this will lead to opening of the DNA. Understood? This acetylation is a negative. So histone histone proteins normally is positively charged. If you know this concept that histone proteins normally is positively charged, okay, and this positively charged histone tightly binds our DNA, which is negatively charged. But when this histone is acetylated, what will happen? This acetyl group is nothing but having a negative charge. This is our acetyl group. So what will happen? This negative and this DNA negative will now open up, and because the DNA is opened up, it is favoring permissive chromatin. Is everybody clear about it? Very good, very good. So the correct answer is histone acetylation. Yes, you are correct that DNA methylation leads to repressive chromatin. All of you are clear? Very good. Let's look at this question. This is a PGI question. Epigenetics is. So you will have multiple correct answers for this. A is alteration in nucleotide sequence. B is alteration in chromosome number. C is alteration in gene expression. D is alteration in chromosome size. And lastly, E is alteration in chromatin proteins. So there will be multiple answers remember for this. So what are the correct answer according to you? C and E. Moksh, quick to answer again. C and E. Anyone else? Kishore is just going for C. Anyone else? Anyone else wants to answer this question? So definitely we have seen that there is no alteration. There is no alteration in the nucleotide sequence. So this is wrong. Also, there is no alteration in the chromosome number. There is alteration in the gene expression. Yes, we have seen that there can be a repressive or a permissive chromatin, which means the gene expression can be increased or the gene expression can be decreased. So yes, there is an alteration in gene expression. In fact, epigenetics is one of the mechanisms of alteration of gene expression. Okay, when we are going to see gene expression, there are so many ways the gene expression is controlled. Epigenetics is one of the way the gene expression is controlled. Okay, then alteration in chromosome size, because the number is not so this also is wrong. Alteration in chromatin proteins. So the proteins, I have told you that histone proteins or non-histone proteins, any change in that, okay, is a part of epigenetics. So yes, there will be. So C and E both are correct option. Is everybody clear on this? C and E both are correct answers for this. Okay, right. Let's move to the question. All of the following are associated with epigenetic modification except. All of the following are associated with epigenetic modification except. Your options. All of the following are associated with epigenetic modifications. So here, Moksh again the first to answer. D, fish eye. Rajeshwari is saying A. Kishori is saying C. Okay. Hi Pranav. Pranav is saying D. So the correct answer here is all these Fragile X syndrome, Prader willi, these are very classical, associated with epigenetic mutation, which we are going to see about paternal and maternal imprinting and expression. Cancer also, a lot of cancer cases where the increased expression of oncogenes have been associated with epigenetic. Fish eye disease is basically a partial deficiency of LCAT. It's a partial deficiency of LCAT, okay, and it is because of a gene defect. It has nothing to do with epigenetic modifications. Okay, so what does LCAT do? LCAT helps to convert cholesterol into cholesterol ester so that they can be transported by SDL back to liver. Okay, so because this cholesterol to cholesterol ester transformation is stopped, so cholesterol starts getting deposited, and because it's a partial deficiency, so the eyes will start having a little cloudy. So this is fish eye disease. Very good, Moksh. Okay, all of you are very clear in this. So this is another question. Moksh was already talking about it. All of the following detect epigenetic mutation except. All of the following detect epigenetic mutation except. Very simple question. Again, it's a PGI question, so multiple correct answers will be there. These are all actual exam questions, so please Okay, Moksh is saying all of the following. So we have to find multiple correct answers, Moksh. It's not, there's no, so you have to tell which all are actually detecting. It's not, Sanger sequencing never detects epigenetic mutation, because Sanger sequencing will just sequence the, base pairs, okay, the nucleotide bases, okay. So it will not tell us about any histone protein or non-histone protein or base pair methylation, all those nitrogenous base methylation, all those information Sanger sequencing will not be able to give. Okay, so B is correct. Very good. First we do is bisulfite conversion, okay, in which we are able to know by bisulfite Sanger sequencing. It's a special two-step process where we first do a bisulfite sequencing, bisulfite conversion, and second we do a Sanger sequencing. And by this we are able to detect DNA methylation. By this we are going to detect DNA methylation, which is a epigenetic one. So B is correct. CHIP sequencing. This is chromatin immunoprecipitation. This CHIP stands for chromatin immunoprecipitation. So we know that immunoprecipitation, what we do, antigen antibody reaction. So here what happens in chromatin immunoprecipitation, let's say this is the DNA, okay, and these are the proteins which are associated with DNA. Very in simple terms I'm going to tell you. Suppose this is the DNA and these are the proteins associated with DNA. So what we do is we have specific antibodies for these proteins, okay, and we do a immunoprecipitation of these portions with these specific antibodies. And once we have got these specific areas where these proteins are attached, then we remove it and then we sequence those areas. So we know which protein, because we have a specific antibodies against that protein, is associated with which area of DNA. Okay, I'm not going into the detail, but so this is CHIP sequencing. Okay, first we do a chromatin immunoprecipitation, then we do a sequencing. So this definitely will help us to know which protein is associated with which DNA segment, and hence it will help us to understand epigenetics. So this is correct. Methylation specific PCR. PCR we know will help us to understand the DNA sequence. Methylation specific PCR again can help us to detect epigenetic mutation. Chromoprecipitation, okay, itself cannot help in epigenetic mutation. So correct answer is B, C and D. Confused? Okay, so are you clear? Hope you are clear. So D will not be the correct answer. The correct answer will be B, C and D. Hope all of you are very confident about this question. So I have already told. Okay, so methylation, these are traditional Sanger sequencing cannot detect epigenetic mutation. Methylation specific PCR bisulfite sequencing, methylation sensitive restriction endonuclease enzyme. Okay, and chip or chip sequencing, chip by sequencing, both of these can again detect DNA chromosome. Okay, so these are the epigenetic modifications diagnosis. Let's look at this. Which of the following does not favor permissive euchromatin due to changes occurring at the cytosine residues at CpG island? Okay, so basically it is saying does not favor means permissive means it is repressive. So already many of you have answered this question in the earlier questions. Which of the following does not favor permissive chromatin due to changes in the cytosine? So methylation is a very correct answer, Moksh. So the correct answer here is methylation. Okay, methylation generally happens in the CpG island, especially in the cytosine residues. So Kishore, it's not sumosylation. So here it is specifically asking about CpG islands. Okay, not about other region. Okay, Prader-Willi syndrome, chromosomal defect is in. So someone already was answering this question before even it was asked, but this is a previous year question. So where is the chromosomal defect? Okay, let's answer this question. Prader-Willi syndrome, chromatin defect. So all of you are very correct, Moksh, Kishore. Hope all of you are understanding, gaining the concept. So the correct answer is 15. So basically, two important concepts or two important syndromes you have to remember. One is Prader-Willi and one is Angelman. Okay, Angelman. So if you see man, so he is here maternal imprinting will be there. Maternal imprinting means maternal gene will be silenced. Maternal imprinting. So because he is a man, his maternal genes are silenced. Okay, now understand this very important concept. We know that there are two alleles. One is from mother, one is from father. For every gene there is two alleles. Okay, in maternal imprinting, what happens, this maternal allele is silenced, so only for those genes only paternal allele is left. Now if there is something happens to the paternal allele, what will happen? They will have a disease. So on all these imprinting disorder, what is happening is, one of the, normally it is happening, normally in every person one of the allele is silenced, so they will all not express the disease. Okay, but only for those genes where imprinting is there and the corresponding allele is missing, or there is a defect in those alleles, those people will show the disease. Okay, so remember, Angelman, because he is a man, his maternal allele is imprinted, which means maternal allele is silenced. Okay, so you can see this specific facial appearance. There is a severe intellectual disability, developmental disability, speech problem, balance, movement, seizure, sleep problem. Okay, so this face, if you remember, you will be able to answer about Angelman syndrome. Okay, now the reverse of that is Prader-Willi. Okay, Prader-Willi, if you remember this child, you will be able to answer anything about Prader-Willi. Willi means small. Okay, Willi means small. So Prader-Willi means a small child. So in a newborn, generally severe muscle weakness, poor feeding, slow development, and this child is constantly hungry, leading to obesity and type 2 diabetes. These are the important things which you have to remember. Okay, very good, all of you. Right, very good, all of you. Let's answer this question. Angelman syndrome is due to. Angelman syndrome is due to. Angelman syndrome is due to. So as I have already told you, Angelman syndrome, any other name, I really do not recall the other name of Angelman syndrome. Okay, mostly we will call it as Angelman. I don't know if there is another name for Angelman syndrome. Okay, at least I don't remember at this point. Okay, so here I have told you that uniparental disomy. Okay, so basically there is one parent allele and that also is defective. So uniparental disomy is what will cause Angelman syndrome. Okay. Okay, happy puppet syndrome. I don't know. I'm not very sure, right, if that term is still being used. Right. Now let's look at this. Histone has post-translational modification by all except. So what is the post-translational modification which is not shown by histone? The options are glycosylation, methylation, phosphorylation, or none of the above. So anyone? So AS Markandi is saying C, phosphorylation. Moksh is saying glycosylation. Kishore is saying that all three can be seen because he has opted for D. The correct answer is histones are not glycosylated. Glycosylation is relatively very rare in histone proteins. Okay, glycosylation generally happens of other proteins, but histone proteins are generally not glycosylated. So the correct answer will be D, A. Okay, right. Acetylation of histone will result in which of the following modification? Acetylation of histone. So these are all previous year question. Acetylation of histone results in which of the following modification? So we have already discussed this. We have already discussed it that when we are talking about acetylation, basically it leads to opening up of DNA. So it is not heterochromatin. Okay, it is increased euchromatin. Okay, so this is wrong. Okay, activates deacetylase. This is again, it is by activation of acetylases. So this is again wrong. Arginine methylation, acetylation does not have anything to do with methylation. Yes, because there is a permissive chromatin, there will be increased mRNA production. So answer is B. Yes, Kishore, you are correct. The correct answer is B here. Okay, neither, because there is an increased euchromatin formation. Whenever there is the DNA opens up, there is a euchromatin. Heterochromatin is more condensed form of DNA. Okay, this is transcriptionally active. This is transcriptionally inactive. Okay, is it clear? So this is wrong, this is wrong, this is wrong. The only correct answer is B here. Very good. So let me just show you, because I have shown a lot of questions around that. So let me show you. So acetylation, okay, there is an activation of gene. Very important. This one slide, if you remember, most of the previous year question you could have answered. Deacetylation, there is an inactivation of gene. Okay, permissive and repressive. Now methylation of histone protein. Remember, this is not the DNA methylation we are talking about. DNA methylation will always lead to repressive chromatin. Remember, but histone methylation can be even activation or inactivation of gene. Very important. Many students feel confused about this. So histone modification, when we talk about histone methylation, it can lead to both activation and inactivation. When we are talking about DNA methylation, it will always lead to inactivation. When we talk about phosphorylation, again it can lead to increase chromatin open or closed. So both effect can happen. But H1 phosphorylation, when we are talking about, we know that histone proteins are H1, H2, H3, H4. Whenever H1 histone proteins are phosphorylated, this will lead to chromatin condensation. So this is repressive chromatin. Okay, is it clear? If we talk about phosphorylation in general, it can either increase or decrease. But when we are talking about a specific H1 phosphorylation, we know linker histone proteins, H1 phosphorylation, it will always lead to condensation. Then there is again monoubiquitization. So again, it can lead to activation and inactivation. But sumolation, that is small ubiquitin modifier, when it is being added. So sumolation, it will always lead to repressive. Okay, repressive chromatin. Okay. ADP ribosylation, remember, it is a DNA repair mechanism. It has nothing to do with this epigenetics. Okay, ADP ribosylation has to do with DNA repair, has nothing to do with it. So this is a very important table. Hope you will refer to this table whenever you. So now let's answer a few questions based on this table. Sumolation leads to So can we answer this question? I've just showed you the table. You will be very easily able to answer it. So the correct answer here will be, as you are correct, the correct answer is chromatin condensation. Very good. Okay. Let's answer this. Monoubiquitization of DNA leads to good human system, A.K. Markinde. Monoubiquitization of DNA leads to so here, because it will lead to both of the above, so the correct answer is all of the above. It can lead to even chromatin condensation, euchromatin formation, everything it can lead to. So the correct answer is D. Okay, and ADP ribosylation leads to this is the last question for today. ADP ribosylation leads to, very good, all of you are correct. The correct answer is DNA repair. So hope it was a useful session. I have covered all the questions which have come from epigenetics in past 4-5 years. Okay, and thank you so much. Thank you Rockstar, thank you Mukesh, Rajeshwari, Pranav, Moksh, Kishore. Thank you for such wonderful discussion, and hope it was useful for all of you. And I'm going, last week when I went live on YouTube, you all requested for a heme discussion on heme. So right now I'm going live on Unacademy. In just next 1 minute I will be live on Unacademy. You all can join me there. There I'm going to discuss heme and porphyria. This is a today 1 hour and tomorrow 1 hour. So that complete heme and porphyria along with question is complete. Complete heme and porphyria along with questions is complete. So all you have to do is just go to the Unacademy app. There you can find this session. Okay, and this is about here. So just let us meet you there, and in case any one of you has any questions, any suggestions, the next session tomorrow on YouTube, just let me see. The next session tomorrow on YouTube will be, okay, tomorrow we have blood glycogen storage disorders. For tomorrow, our session topic is glycogen storage disorders. Glycogen storage disorders. So hope to see you all on the Unacademy platform for a 1 hour session on this. Okay, and don't forget to like this video so that this video stays in your history, and you can come back to it in case you want to revise this topic. Thank you so much, everybody. Thank you so much. Take care. Bye.